Spencer, and welcome back to STEM Forward, the podcast where we discuss career options in STEM with the world. So that's science, technology, engineering, and math.
That's right. Hi, I'm Dr. Stephen Jones, and we have an interesting episode where we'll explore a career that's making a real difference in people's lives. That's occupational therapy assistants and aides.
Absolutely. From helping people recover from injuries to assisting those with disabilities, occupational therapy assistants and aides play an essential role in healthcare. Today, we'll discuss what they do, how to become one, and their job prospects and more. You know, Steve, being a K-12 principal for over a decade, I have had lots of opportunities to work with occupational therapists and occupational therapist aides and assistants with my students throughout the year. So this is going to be a fascinating conversation.
And I think any career, it takes exposure to the various people who are in that career to begin to think about it. So that's why I think we're doing this today as a great way to inform more of an audience of the opportunity. But we'll cover everything that we need to, from the work environment to the job outlook and pay. But before we jump into that, here's a quick reminder. Make sure you subscribe to STEM Forward and share the podcast with your friends. Now, let's go.
So what exactly do they do? You know, so you got therapy assistants, occupational therapy assistants, and aides. Their main role is to help the therapist provide treatment, assist the clients in regaining daily living activities. And some of the chronic conditions that they work with, the occupational therapists, are spina bifida, cancer, multiple sclerosis, and cerebral palsy, along with Parkinson's disease.
Right. The tasks vary depending on the role. Occupational therapy assistants typically guide clients through therapeutic activities. For instance, they might lead exercises to improve motor skills or teach a client with Parkinson's disease to use special equipment or to make tasks like meal preparation easier. You might need occupational therapists while you're recovering from an injury or trauma, including bone fractures, burns, carpal tunnel syndrome, strokes, amputations, and traumatic brain injuries.
Wow, that's a lot. You know, you can't forget also their work with children, whether it's in the school or the home setting. So they assist children with various disabilities, helping them with social skills and activities to promote development. Some of them include the disabilities that they work with are children on the autism spectrum, developmental delays, and also Down syndrome.
Occupational therapy aides usually handle more routine tasks. They help to set up treatment areas, clean equipment, and assist with paperwork and scheduling. They're vital in ensuring that the whole process runs smoothly, even if they don't provide the therapy themselves.
So one of the things I could say, Steve, thinking about as we're having this conversation, that the demand is real. In my current setting, we have needed a occupational therapist, and the demand is so high, we don't always have one available, especially to be there 5 days a week. I think a lot of times we have to contract with various agencies to make sure that we have the assistance that we need. So both positions, whether you're the therapist, the assistant, or the aide, are very essential to ensuring patients get the best possible care. All right, Steve has a phone call through this. You know, that's true. My son is actually was texting me. I was trying to, you know, hide it while we're recording, but that's life. And, you know, we're trying to help you put on a pathway so you can have these types of interruptions. So like I was saying, all the positions are essential when it comes to occupational therapy. So there's various pathways. I was talking to a friend the other day whose child was interested in going to the one of the healthcare professions with their first undergraduate degree, but they did not have the GPA to get to the program that that they desire. So one of the things we talked about were some alternatives to use as a stepping stone in their undergraduate degree to apply to that professional school once they're finished. There's more than one way to get to your goal. So that's one of the reasons, with STEM Forward, we're trying to make people aware of these various paths.
Because sometimes actually they will ask you to take a few undergraduate classes, and then if you pass them with certain grades, then they'll let you in to actually go toward the degree. So you're right. I mean, there are different ways that you can get into it, different initiatives that they're taking themselves to try to get more people into the field.
Well, with that in mind, we're going to take a brief break. This is a great time to mention, make sure you are subscribed to STEM Forward. Share our podcast with anyone that's interested in learning more about impactful STEM careers.
Do you want your students to earn excellent grades? This is Dr. Stephen Jones, author of 7 Secrets of How to Study, the nationally recognized book, and my online course. The students in your organization can earn A+ grades in just a few hours. Get the 7 Secrets of How to Study course for your students. You won't regret it. Now, let's discuss the work environment for these roles. Occupational therapy assistants and aides typically work in hospitals, nursing homes, occupational therapist offices. They spend much of their time on their feet, setting up equipment or working directly with patients in the case of assistants.
Well, it can be a physically demanding job as well, and anything, especially with the title therapy, there's always lots of kneeling, lifting, standing. But if you enjoy being active and really helping people, this is a great role for you. And it can be very fulfilling.
In addition, I'm sure that you're going to need good communication skills as you're working with the patients and being a patient person to work with them as well. So how does someone get into the field? Occupational therapy assistants require an associate degree from an accredited program. The program usually takes about 2 years to complete and includes classroom learning and hands-on in the field.
But before we get to this next point, you brought up something about communication earlier, because a lot of times you're dealing with people in very vulnerable positions. And so being able to communicate with them, to show empathy and to build that trust to help them with their recovery, or to help them, uh, get to a certain point within their treatment, communication is very important. So, you have your coursework, you finish your program, and after that, you need to get your license, which usually means passing a national board certification in the occupational therapy exam, or the path is a little simpler for aides, a high school diploma and on-the-job training is typically what's required, but it still takes skill and dedication.
It's great that the barrier to entry is lower for aides. Still, for those wanting to advance their careers, there are opportunities to move up to assistant or therapist roles with further education and training. You never can get
Exactly.
too much education. You can always find a way to go to the next level, both through your education and positions that you assume within the field.
Yes, so some of these career pathways that we're going to present through STEM Forward are really stepping stones. You don't stop with one certification and one pathway. You may start off as an occupational therapy assistant or aide, but then it may be something within the hospital, the nursing home that you find interesting, and you may try and go for another certification. But the jobs that we present will always afford you a living wage to create a sustainable lifestyle. So that this career definitely offers room for growth. But before we talk about pay and job outlook, this is a reminder, make sure you are subscribed to STEM Forward on all your social media. We're on Instagram, YouTube, and TikTok, and coming to other podcast platforms as well in the very near future. If you know someone that's considering a health career, that's about to graduate from high school, that this is something that is really worthwhile and to look into, especially with the aging population within the United States. Now, we'll take a small break and we'll be back, and then we'll dive into pay and job prospects. Are you a solo entrepreneur, entrepreneur, or small business owner looking to establish a strong online presence? At Teach It Labs, we specialize in creating mobile-friendly websites tailored just for you. Our customizable templates are easy to showcase your brand without any coding experience. Plus, with our learning management systems hosting, delivering educational content online has never been simpler. Ready to elevate your business? Visit teachitlabs.com and let's build your digital future together.
One of the things that you talked about earlier, John, was about livable wage. I think that that's so important, especially as there are a lot of jobs that are kind of minimum wage. So as you're looking into this field, you'll find that there are good opportunities and there's potentially good pay for you. So let's dive into pay and job prospects. Okay, so let's talk about money. In 2023, the median annual wage for occupational therapy aides was about $36,970. That's not bad for an entry-level position, but the assistant role pays more.
Yeah, the assistant role has a median salary of $67,010 in 2023. And of course, that'll vary depending on, where you live in the country. But that is a solid wage for a career that's in demand. Like I was saying earlier, I've seen, often in K to 12 settings with very specialized classrooms where occupational therapy assistants or occupational therapists are needed, there's often a shortfall. So this is definitely a career that's in demand.
And it's in high demand. The job outlook for occupational therapy assistants and aides is fantastic. From 2023 to 2033, employment is expected to grow by 21%, which is faster than the average for all occupations.
Absolutely. And one of the things that is really pushing this is an aging population. As more people age out, there's more conditions like arthritis, strokes, and other disabilities that will need occupational therapy assistants and aides will continue to increase. So, that's one way of looking at it. So it's really at both ends of the spectrum. You have children that may have developmental delays in early K to 12, but then you have people that are entering the winter and fall and winter of their life that need these types of services. So there's definitely a need. We might need people.
And I was going to say that also um, location. So big cities, small
Mhm.
cities, suburban, urban. So don't look at just one place that you can actually do this therapy. There are a lot of senior citizens who need help in those different areas outside of the larger cities. So keep your options open and possibilities open. Uh,
And the one,
so,
huh? Go ahead. Go ahead, Steve.
so it's not only is this a rewarding career, but it's also a stable one with strong prospects and the right certifications and experience. You can grow in this field.
Mhm. And one thing, this career has a track record of the assistants moving on to become therapists in areas like low vision or pediatrics with additional credentials. So the majority of people within this career use this first part as a stepping stone to move forward.
Yeah, and for those wondering about job comparisons, positions like dental assistants, medical assistants, and home health aides have more similarities in duties and entry level requirements. However, occupational therapy assistants typically earn more and work in a healthcare setting with a lot of room for specialization.
So whether it's an after-school program or a club, the more exposure your children have to various types of careers, they'll start developing their own ideas, perspective, career pathways. So that is one of the reasons why we try to produce, why we produce STEM Forward to help parents and children understand possible career choices. If you check out our YouTube channel, we have some YouTube shorts, they're about a minute long, explaining various careers. So that's another resources for parents, schools, and mentors.
And also, when we look at this, the whole job prospect and outlook, and um, there are students who they come out of high school, they're still not totally sure what they want to do, but they need exposure. So starting off in a community college can be one of the best things for a student instead of jumping into a 4-year institution um, and still feeling their way, but they could save a lot of money by taking advantage of the 2-year experience and then deciding whether they want to go further. And in the 2-year experience, they can become one of these occupational therapy assistants and then decide if they want to continue to grow within the career. So I think it makes it a lot easier and is less costly. I'm always thinking of dollars as well to get you to jump into the field and see and also the internships that you have as part of it, I think also help you to grow and make decisions as to which way you want to go. As
And
always, make sure that you subscribe to STEM Forward and share this episode with someone who might benefit from it, and check out our next episode in which we will discuss another exciting STEM career.
oh, but before we end up, Steve, you just made me think. You talked about that 2 years. Most parents and children aren't thinking about it. That's from 18 to 20. So if you decide to pursue something like occupational therapy aid, by 20 years old, you can have a job making 36,000, almost $37,000 a year. And that's far beyond minimum wage. Most likely, you'll be in a position where you're also getting medical benefits. So when you're thinking about career paths, um, that 2 year window right after high school can really be a springboard, a spark to something even greater.
And really, there's different types of programs that exist. So to continue your education, making sure that you have enough financial aid and resources to do this. I wanted to mention that a lot of times adult learners get involved. And when I say adult learners, those who are 24 years old and older, when you look at
Mhm.
community college, a good group of the students who are coming through community college are older adults, and they're looking to change their careers, looking to do something different. They've had an interest in healthcare in some way, but they weren't able to start on that pathway while they came out of high school. But now, hey, they're 24 and they're still, I still have life ahead of me, and here's an
Hmm.
opportunity that I can consider.
Hmm. Well said, Steve. And with that, we've covered a lot of ground today. If you're interested in careers that combines helping others, physical activity, job stability, occupational therapy assistant and age might be the right thing for you.
Definitely. Um, I'm excited about this. This is such a great opportunity. I have relatives that might even want to consider this as an option. Um, As always, make sure you subscribe to STEM Forward and share this episode with someone who might benefit from it. And check out our next episode, in which we'll discuss another exciting STEM career. And STEM is a great opportunity for those of you who have always had an interest in science, but maybe you weren't able to explore it as much while you were in middle school and high school. Now you're coming out and you see the opportunity ahead of you. And hopefully, we've given you some tips and strategies that you can use to get started in the field, do something new, do something that's fantastic, and actually offers a living wage, which is something that many times certain careers don't offer today.
I'm Dr. John Spencer.
I'm Dr. Stephen Jones.
Thanks for listening to STEM Forward or even watching, and we'll catch you next time.
Thank you for tuning in to STEM Forward. For more information about this episode, visit our website and check out the show notes.